Assalamualaikum doctors. In this video, I'm discussing about the non-accidental injury history management portions. So some from this picture we can learn some features of non-accidental injury, what we find on history in supporting diagnosis, like bruises, welts or broken bones, okay, cuts or scrapes, burns, missing hair, injuries or redness around the genitals, injuries at different stages or healing, injury or medical condition that has not been properly treated. So delay, they are seeking medical advice, not treated, old healing, different stage of healing bones, these are. So normally non-accidental injury, the DD we can keep like rickets, osteogenesis imperfecta, neglect and immunodeficiency. Now discussion, how can we manage a NAI patient? NAI come on history also is come on video stations. So first of all, I will assess the patient carefully. I will assess ABC and vitals. Okay, I will assess the dehydration status in the form of capillary refill time, perfusions, amount of urine in nappies, skin turgor, entry fontanelle, is it bulging or depressed. Nutritional assessment by skin fold thickness and mid-arm circumference. I will do a full skin examination and glass test. Full musculoskeletal examination with a full range of movements. Full cardiac, chest and abdominal examination. Again, examination is that I will assess the patient carefully. I will assess the ABC and vitals. I will assess the dehydration status in the form of capillary refill time, perfusion, amount of urine in nappies, skin turgor, entry fontanelle, is it bulging or depressed. Then nutritional assessment by skin fold thickness and mid-arm circumference. I will do a full skin examinations and glass test, full musculoskeletal examination with a full range of movements, full cardiac, chest and abdominal examinations. I will examine the patient generally for signs of NAI. So signs of NAI generally examination, from nail there is long dirty with koilonaica. So nail is long dirty with koilonaica. Then arms there is pulse, muscle, wasting, deformities, burn marks, broadening of the wrist joint. So when you go the arm, the pulse, muscle wasting, deformities, burn marks and broadening of the wrist joint. Then head, shape of the head circumference, any craniotapes, entry fontanelle, bulging of for increase in intracranial temperature, depressed in dehydrations. So head, I will examine shape, head circumference, craniotapes, entry fontanelle, bulging for ICT and depressed in dehydration. Then eye, about the pallor, bluish sclera, subconjunctival hemorrhage, shrunken eye, if tear or not, and recon eye. Again, eye, pallor, bluish sclera, subconjunctival hemorrhage, shrunken eye, if tear or not, and recon eye. Then nose, any discharge from the nose. Then mouth, pallor, broken teeth, torn frenulum, dry or moist. So mouth, pallor, broken teeth, torn frenulum, dry or moist. Ear, any discharge or blood from the ears, battle sign on the back of ear. Again, ear, any discharge or blood from the ears, battle sign on the back of ear. Lymph node examinations. Then back, bruises and deformity. Okay, back examination, bruises or deformity. Then chest, capillary CRT on the sternum. Then rosaries, deformities, fracture or bruises. So in the chest, is there any CRT on the sternum, rosaries, deformities, fracture or bruises? Abdomen is dirty umbilicus, dehydration, bruises and palpable for toast liver. So abdomen, dirty umbilicus, dehydration, bruise and palpate the for toast liver. Genital and nappy area, nappy rash, ammonical dermatitis, petulous anus, urine output. So genitalia and nappy area, nappy rash, ammonical dermatitis, petulous anus, urine output. Lower limb bowing of the deformities, callus formation and Marfan sign. So lower limb bowing deformities, callus formation and Marfan sign. Okay. So after all the examination we do from head to toe, I will involve my senior, my consultant for admissions. I will involve, of course, we admit child. I will involve the child protection team, safeguarding consultant, social worker, and police. So child protection team, safeguarding, social worker. ABC, correct dehydration, if present, take his vitals, take his measurements and plot on the centers appropriate for age and sex. So first, correction of the air breathing circulation dehydration status. If the child is in pain, I will give analgesic. Document any bruises by photos and comment on the color and nature of the rash and bruises. Also document interaction between the child and the caregiver. Full specific child abuse form and document general state of the child and details of all body area examinations. Revise his file for previous documentations. Check the safety of the child at home. Treat injuries accordingly and test to exclude other differentials. So management, how can? First of all, I will involve my senior, my consultant for admissions. I will involve the child protection team, safeguarding consultant and social worker and police. ABC, correct dehydrations. If present, take his vitals, take his measurement and plot on the suntiles appropriate for age and sex. If the child is in pain, I will give analgesic. I will document any bruises and by photos and comment on the color and nature of the rash and bruises. Also document interaction between the child and the caregiver. Full specific child abuse form and document general state of the child and details of all body area examinations. Revise his file for previous documentation. So previous note also I collect. Check the safety of the child, other child in the home. Treat injuries accordingly and test to exclude the other differentials. What investigation I will run? Full blood count, coagulation profile, liver function test, bone profile, 24-hydroxychloroquine in urine, blood grouping and factor 8 and factor 9. X-ray of the wrist, CT, brain if less than 1 year or head injuries. Skeletal survey if less than 2 years, repeat after 14 days. DEXA scan for bone density which may be diagnosed if it has oxygen imperfecta or X-linked dominant hypophosphatemic rickets, and fundoscopy for the retinal hemorrhage. So the investigation are, first of all, full blood count. Okay, full blood count, coagulation profile, liver function test, bone profile. Full blood count, coagulation profile, liver function test, bone profile, 24-hour hydroxychloroquine in urine, blood grouping and cross-matching, factor 8 and factor 9 assay. And then X-ray of the wrist, CT of the brain if the less than 1 year or head injuries. Skeletal survey if the child is less than 2 years, repeat after 14 days. DEXA scan for the bone density which may be diagnostic if child has osteogenesis imperfecta or X-linked dominant hypophosphatemia rickets. Then fundoscopy for the retinal hemorrhage. So this is all about the non-accidental injury management portion. Thank you.